1 2 1 2 1 1
2 1 2 2 2 1 2 1 2 then 1 2 2 1 2 1 2 1 2 2 2 1 2
Hello.
Many people?
Private event. No, it's okay like that. I just need to know how to wait to see.
One, two.
1 2 1 2 1 2.
Here?
And where's Prof Mponga? Okay, cool. Good evening, everyone. Welcome to Victoria Falls. Thank you for some of the legends that are here tonight. Is it working? Can everyone hear me? Well, I'd just like to thank some of the legends that are here tonight, people who we've all met over the last 4 years or so. And I'll start going in order from right to left. So thank you, Dr. Hector Carvalho, for coming the whole way from Argentina. You made a huge difference to Zimbabwe in 2020 with your IDEA protocol, which was ivermectin, dexamethasone, and aspirin and enoxaparin. And that was March 2020, which was very, very early on when a lot of us were struggling with very, very sick patients. So I'd like to welcome you and thank you for coming the whole way. We'll get some more information from you. Dr. Martin Wucher, I've been talking to you for 3 or more years on some of these groups, especially with frontline doctors that have been helping patients over the last many years. So why did we decide to have the Healing in Africa conference? Well, Dr. Wucha and I were both on a show in Australia, of all places, in April, and we were discussing the contrast between African heritage-based health systems and people who lived in a culturally rich and possibly less advanced way, and comparing it to what's been happening in the so-called advanced countries. And it's certainly been our experience that it's very clear, and Dr. Wucha will cover that tomorrow, that heritage-based health is the way forward, and that the more natural that we can be, the better. Dr. Chetty, thank you for coming in from straight from Malaysia to here presenting. Another one of the people that's really helped countless people in the last 4 years. So thank you for that. I don't want to spend too much time talking because we're enjoying the healing environment of Victoria Falls. I'd like to mention that Victoria Falls only lost 2 people out of 35,000 in 3 years here. And much of that was because doctors were allowed to treat patients in their own environment. And the only 2 patients that died were transferred to high level hospitals elsewhere in the country. So, with that, I'd like to ask Hector to say a couple of words, especially about your 2020, or how you came up with the IDEA protocol, and your publication in November 2020, which we followed in Zimbabwe, which prophylactically saved a number of probably medical professionals' lives. And then I'd like to hand over to Professor Maponga, who is the head of our Natural Therapies Council in Zimbabwe, and he's going to speak to us about heritage-based health and the constitution of Zimbabwe. So Hector?
Well, thank you, Jackie. I'm not used to using a microphone. I'm overwhelmed by your words. Okay. I said I'm overwhelmed by this and the cameras and the microphones. I have one here and another one here. And I cannot put in words what we have done. It could be because English is not my mother tongue, but I cannot put it in words in Spanish either, because we think we didn't do anything extraordinary. We just did what we had to do, nothing else. This has been a war, a real war, and in a war, you're obliged to participate, and not what you would like to have, but what you have, and to make the best of it. And we didn't think of something extraordinary. We just thought, because thinking was something that was absent of this war. And it was the sad thing is it was deliberate to avoid thinking. And well, I'm very glad to have been of some help to the people here and to the patients, because that's the only reason why we medical doctors have to behave. We are supposed to work for the people's well-being, for the people's health, to heal the people, and nothing else. If we don't do that, what are we supposed to do? Well, later on, I don't want to bother you with the details, but we'll have ample time to talk about what we have done. And once again, thank you for allowing us to be here. Jackie, you have promoted a very wonderful meeting, and I promise tomorrow I will watch through the sunset. Okay? Thank you.
Professor Maponga, can I invite you to open the summit?
Oh.
Thank you very much, everyone. Dr. Stone, I admire you today, and thanks for making me and all the Zimbabweans so proud because of the work that you have just done. Having said that, I would like to reach out to our international visitors, our regional visitors who have honored us today by visiting one of our best holiday resorts in the country, but to discuss this pertinent subject. So I want to thank you for this opportunity to present this short statement on our agenda setting for integrative health in Zimbabwe, which is a guide for research, training, service delivery, and publicity in traditional, complementary, and integrative medicine. Just to give you a background to this, the background is that in the process of aligning its laws with its new constitution, Zimbabwe has increased its emphasis on culture, traditional knowledge system, and in its national objectives as expressed in Section 16 and Section 33, respectively, of Constitution of Zimbabwe, Amendment number 20 of 2013. That's our new constitution. This new constitution has strengthened the existing legal frameworks promoting and regulating traditional knowledge-based health practices. And these laws include, number one, the Traditional Medical Practitioners Act, Chapter 2714, which enables the existence of the Traditional Medical Practitioners Council as a standalone council. Number two, Part 6 of the Health Professions Act, Chapter 2719, which enables the Natural Therapists Council of Zimbabwe to exist as one of the 8 councils operating under the Health Professions Council of Zimbabwe. It is actually this council that I am chair, as you heard from the introduction. At the World Health Organization level, whose guidance we follow as a member state, with the world moving towards universal health coverage, the World Health Organization has drafted a new 10-year traditional medicine strategy that will be presented at the World Health Assembly for approval in 2025. So Zimbabwe feels that there is a window of opportunity to leverage on its constitutionally guided mandate to craft its own traditional, complementary, and integrative medicine model and provide valuable input in the WHO strategy. As part of Vision 2030, that Zimbabwe has set for itself to become an upper middle income country, Zimbabwe needs to leverage on the relevance and topical nature of the concept of traditional, complementary, and integrative medicine, and also have an input in this that we call integrative health. Integrative health, we define it as an approach to the provision of health services that makes the use of best available evidence, taking into account the whole person, that is body, mind, and spirit, including all aspects of lifestyle. It emphasizes the therapeutic relationship and makes use of both conventional and complementary and alternative approaches. Wellness promotion, self-health care, and lifestyle management are central in integrative health systems, most of which have an active and often low-cost focus on reducing non-communicable diseases, risk factors such as physical inactivity, obesity, drug abuse, diet changes, and stress. Integrative health has the potential to help address specific global challenges such as these NCDs and even antimicrobial resistance, which is increasing every year. So, on recommended approach, in the Zimbabwean context, the recommended approach is as follows. Number one, utilize academic, public, private sector partnerships approach to implement an investor-driven healthcare option. I'm going to just emphasize this. Victoria Falls is a special economic zone, whereas Zimbabwe, we feel that this should be a prime region for us to attract investment. We also feel that if we are really going to move fast in the health sector, we have to promote private investment. Private investment that is driven on the ideals of integrative health should actually lead us to more accessible, more affordable, and effective healthcare. So number two, focus on integration of traditional and allopathic medicine through collaborative research, funding support, clinical trials, publication, education, media engagement, policy advocacy, and patient engagement. Number three, partner with civil society, including public and private higher and tertiary education institutions, to generate competent, registrable, integrative health professionals. Number four, contribute to advancing the field of integrative health, fostering collaboration, once again, between traditional and allopathic practitioners, and improving healthcare outcomes for diverse populations. Let me just do a paragraph to emphasize on the benefits, because the whole idea of an agenda setting is to actually sell ourselves so that we can get as many people to come on board as possible. So number one, so the benefits of integrative health approach include, number one, addressing the high cost of health service to ensure universal health coverage. Comprehensive healthcare service which promotes wellness in an affordable, sustainable, inclusive manner that is aimed at leaving no one behind. Accelerated training of healthcare professionals in integrative health. Training in integrative health. And I'm saying we are one of those countries that have got a very good higher and tertiary education. However, we suffer a lot of brain drain when our health professionals leave the country. So there is a huge gap in health professionals that we constantly have. Now we need innovative ways of closing the gaps that are much more efficient and inclusive. Number four, promoting international health sector investment through international academic and business collaboration. Again, on the investment part of it. And finally, due to the heritage-based thrust, which comes from our constitution, as I said, integrative health approach will be inclusively set up in every province. You will hear that one of these approaches that Zimbabwe is taking right now is to decentralize provinces. So each province is aimed to look after itself and ensure that in all sectors, education and the health and all the other investment areas are actually covered to make sure that no one is left behind. I would like to end my the statement there. And so with these few remarks, I would like to wish us all a successful inaugural conference. I just want to end with a saying that I have heard. We don't get tsunamis here, but that saying actually makes sense because it says a butterfly can flap its wings and cause a tsunami. Could this be the black butterfly that is flapping its wings? Is it going to cause a tsunami or a revolution for us to move forward in integrative health? I believe so, and I thank you very much.
Thank you, Professor Maponga. And with that, I think we should cut the recording, Pride, and welcome everybody to Victoria Falls. And I look forward to a few days of some very interesting functional medicine. Thanks very much, everyone.